Okay, welcome everyone to the 48th Health Teaching Workshop of the Keshe Foundation Spaceship Institute. It's Tuesday, December 1st, 2015, and we're here with Renan today to give us a teaching, and I believe he's ready to go there. Hi, Renan.
Hello, good morning, good evening, and good afternoon, everyone. So, I'll be giving a case, or we'll be discussing to you a health case and using of our devices in our social service hospital. So, just to give you a background, we're dealing with, let me see, for a while with a Facebook. No. Okay, so we're dealing with tuberculosis. So a different way of tuberculosis, I'll check the Wikipedia. Let's read it. Can you help me, Rick, just for tuberculosis? For Wikipedia, yeah, just read on the tuberculosis. I got my window shut down. Yes. Okay. Okay. That's okay. Okay. So just the background. So the TB virus or the bacteria, TB bacteria is common in the tropical countries like Philippines. So we have conditions here. That's why there is TB vaccines have been spread around the country. But this case about tuberculosis is we're seeing a more severe case on tuberculosis. So, okay, can I share my video? Okay, so the TB usually it's on the lungs. So it's the pulmonary, uh, the lungs or the pulmonary part of the body has been affected by the bacteria or the virus. So what happens is it eats up the different areas of the lungs, then causing the lungs to fail. So just that's the simple definition of it, not medical. So I'm not medical, so I'll tell you that the simple definition. So next is what happens to this patient. He had the tuberculosis bacteria went to his spine. So he had a worse case than the normal staying in the lungs. So his lungs has TB, but it went through his spine. So his backbone. So there are four parts of his backbone have been infected with the virus with the bacteria. So what happened with this is it was the bones was eaten up. So the condition was supposedly he was not able. The doctor said that he cannot survive. If there will be an operation, it will have 50-50 chance to recover. So what he did, the hospital did. So they did proper diagnosis on it, and did a surgery. So they removed the infection and arrange the bones again at the back. Arrange the broken bones or the crushed bones or the infected bones. This one here, they arrange it again, and this one, another one, another one. They arrange it and they put a metal case, a metal tube here. I think it's a titanium just to support it because it cannot handle anymore this weight. So it's the good bone spine here and this spine here cannot handle this one. So it will collapse. So they put a connection just to connect again the spine. So basically, the surgery was a success for the patient, but he was told that he cannot do his natural work anymore and will need to recover for 6 months or 1 year before he could walk without assistance. So he's also undergoing a therapy right now that physical therapy to help him walk. So I will show you pictures and before and after we applied plasma gadgets uh, in his recovery. So this case we didn't do any repairs or processing on the illness, but we are doing repairs or processing on the recovery. So I'll share my pictures on how what are the gadgets or what are the devices that we use for him to recover. So with the doctor's advice, she told us that with normal medication and rest and proper therapy, physical therapy, he will walk without any assistance within the after 6 months of therapy. So that's their diagnosis, and that's their hope that he can still recover. But he can have difficulty in moving because of the pain and the uncomfortable feeling of the metals on his back. So that will be the case. So I will show you first the device before we put on the what happened afterwards. Okay, so I'll share my picture for a while. Okay. So now you can see this is patient one. So I'll not just use his name. Patient one, that was his case. So I'll show you the pictures of his surgery. It was a good surgery. So the surgeon was good. So this was the already healed, already closed. So this was 1 month after surgery. You can see his back. So it has a long cut. So this is the middle part. They put the metal, the titanium in that area. So he's just wearing one of the devices. But before that, I'll show you a video that is testing the motor skills of the patient. I will share the video for a while. Ang imong gusto dapat makabarog na ka. Just for a while. Okay. Ikaw ra usad ay maka-normal na. Is there audio? Una yung kontrata sa ginawa. Okay, I'll just mute the audio because it's in our dialect. Okay. So this is Bernie, patient one that we are doing a interview for him before giving him the device provided. Oh, sorry. I forgot. Okay, I did screen share it for a while. I thought I was screen sharing. Share screen video. Okay. Okay, so you can see the video. So play the video. Okay, so this is the patient one. So in this condition, he's still lying down, resting, and we're giving him instructions on what we will give him. So the device that we will give him. So I'll move it forward. So we're explaining this is the finished product or finished device, the foam and a belt. So I will show you how we made it later. So how to use it, and I'll move forward. So our knowledge seeker Danny is explaining how it works uh, to belt it around his chest so that to have a close field. And let me go forward. I'll show the motor skills. So we're just putting how to put that there. Okay. We're explaining to him how the fields will interact when it's wrapped around his body. And this one is another one is the cup that we are using for him. So it's with the one I discussed few months ago, last August, the health cup. So with the coils and patches together. So we use this both for water, drinking water, energized water to energize the water, and also we use it for breathing or a breather to energize the lungs, the brain, and the heart. So instead of putting water in it, we just put a straw to breathe on. So if he wants to empower the lower part of his body, the physicality, he use it in his daily drinking of water. Okay, so let me go on. So we're testing here. Okay, I'll go back. We're testing here his leg skills, motor skills. If he can raise it long enough. Okay. Okay, so he's doing great now. He's gonna raise it. But one thing, there's still vibrations or jolting of the foot. It's like it vibrates. See, so you can see that it vibrates, or it has still a involuntary muscle action. Yeah, it's like a switch, a twitch when you, because it's there's it's not complete yet, so the recovery is not complete yet. So there's a reaction in his motor skills that it twitches. So okay, so that's Dr. Solosha who is administering the patient. Okay, here you can see still it's hard for him to sit down. Okay, and we need to let him stand, so he needs assistance to just support his back before he could stand. This was last November 19. Okay, so we let him walk, try to walk. So okay, few steps. The pain is still there at the near at the back part. Okay, let me see. So now you see the patient who's already in recovery mode, but needs to recover for 6 months. So right now we provided him the plasma bed, or which called the nano health wire and patches bed, for him to help him process the recuperating or the healing of the wound, and also the the pain, and also hopefully we recover the motor skills fast, so he can walk and everything. So we're just preparing those things, and we teach him how to wear the belt just there, just to complete the field's interaction, because the bed or the foam has already all the fields coming out. So just to have a complete loop, we use the belt in the area of the wound around his body. Okay, so yes.
I'm reminded that it might be a good idea just to um, let people know that we don't encourage anyone to do these experiments without complete
Yes.
supervision with medical doctors involved, which is the case the way you're working with it now. This is an actual medical experiment under controlled conditions and so on. Correct?
Yes, this is we are showing you under supervision of a professional, a doctor, who allowed us to do experiments in a social service hospital that she is handling, and also the patient signed a form to give us authority, or to give us permission to share all the information and all the data. So we are legally in our country. We're legally doing it properly. So this is allowed here. Once it says we have consent with the patient, and we have a doctor side by side with us doing these experiments. So it is not advised to do these experiments unless you have full consent with your government and your professional doctors and the institution that is being involved, as well as the patient. So please be
Good.
reminded. So
Thank
I'm
you.
sharing this with specific devices for us to learn and see what are the effects that we are making right now.
And does that apply to the health bottle as well? There's a comment in the live stream. Can someone please link the video with Renan about the health bottle? I found several videos, but no video with Renan in it. Is that something that is presented to the public at this point, or is it still in the research and development sort of stage?
The bottles have been discussed in last August. That was the 74th, 75th Knowledge Seekers, I think. And it's on that. So the basic principle of the bottles have been already discussed before. So you can check on the earlier Knowledge Seekers workshop. I presented some of the nano and health GANs applications.
Okay, that might be in
So
it might be in one of the harder to find workshops as well. So it's a couple of those 70 workshops I'll be putting out later on this week. So okay,
okay,
thank
but
you.
there are cut videos on it. It's on the Keshe KF Phil YouTube channel. KF Phil YouTube channel, wherein only the nano health presentation was covered, about 30 minutes or 16 minutes. So you can check on the KF Phil site, YouTube channel, for those nano and health videos.
Okay,
Okay, so I
thank you.
will continue on the pictures. I will stop sharing. I'll show you how we made them. And after that, I will show you the results after a week. Let me get the pictures. for a while. Give me a minute. Okay. Okay. So share screen.
Renan?
Yes.
Hey, this is Phoenician. How are you? I had a question for you.
Oh. Oh, Caleb. Yes.
How you doing? Hey, listen, I
Doing
was
great.
looking at that belt you had, yeah, that you
Yeah.
were putting around his shoulder, yeah? And it looked
Yeah.
like it was shiny on the outside. Is that a metallic tape or something like that you're using?
Oh, it's just a duct tape.
It's just duct tape.
Yeah.
Um, we
We
we were
just wrap
actually
it around.
we were actually experiment with duct tape, and we found that it affects the fields because of the metals that are inside of it. So I just wanted to throw that one out there to you because we had a few problems with
Okay.
this.
But our duct tapes here have no metals inside. It's just a
Oh,
cloth tape. Yeah, it's
okay.
a cloth tape. It's more on the fibers. There are no metal elements on it. Okay, so I'll show you. These are the pictures first. So I'm showing here the GANs that we, or the caustic mix that we were using for nano coating. Okay, so you can see here this quite purple. It's made up of eggshells, native eggshells, and we added salt, water, and hot caustic. So after a while, the eggshells were crushed before, so we powdered it. Some are not powdered enough, so we powdered it, and we put hot caustic on a container before this plastic container. So then we put a little bit of salt, rock salt. So after a while it turns purple, light purple. So you can see the eggshells on bottom there. So this caustic mix, we use this, put it in a bottle sprayer, and we sprayed the coils that we use. So these are the coils. So you can see, I focus it, okay, there. You can see the coils, okay. So it's like a funnel. So the other end is just an open end to interact with the next coil when it's positioned. The other end is still open; it's not folded to direct the field as well there. So there are exits and entrance for the field. So there's no returning. So there's all both exits and entrances. So you can see that this is before nano coating. So we made about 55, or it was 36 coils. Let's see. So now we position them after nano coating. We nano coated this and it turns black. So we position the mat like this. So it's not so clear. So it's been black already. You can see we put cups, plastic cup cover of the water bottles, plastic water bottle cups. So just to insert, so we made a hole. This rubber is the hard rubber, the one you put under a carpet. It's a hard one, so it doesn't get flat easily. So we cut a hole and inserted the cups, the plastic cap, not cups, cap, and it put the coils on it, pointing upwards. So pointing the funnel upwards. I'll go next. So it's more than a meter long. That's a meter stick. So you can see here how it is formed, how is it positioned. Okay. So this was the final. Okay. And now next as we have taught last August about the patches, the CO2 water patches. So we use the CO2 water patches. From these patches are still the patches last August that I shared with you, the same source. So we just refill the water. That's keep on refilling. So I think we have refilled it many times already, and we have shared the water, the energized CO2 energized GANS water. We just refill and make more plastic patches. So with this, you can see we cover it with patches, and we put duct tapes to cloth duct tape so to hold it there. Then we put on more patches to cover the bed, to cover the foam. So this device is for personal use, only one person use, because of the water or the GANS water, which records the information. Here it is, we put duct tapes to stick the patches, and we covered another thin rubber foam, so in case it won't pierce. Then we added this one. This is a softer foam for him to be comfortable when he sleeps. There. And we put sheet, cloth sheet, and that's it. So the belt, I have no pictures for because we just added it and we forgot to picture how we made it. But it's the normal belt. Then we still use the same coils without the funnel, just round spiral coils, just spread around the belt in frontal. And this is the cup. So what we use, the patch with the coils around it. Okay, and yeah, so let me go on. Okay, so that's how we did this, and you have seen that we have already given the device, and I will show you the video after 1 week of using. So let me stop sharing. I will share the video. Any questions on the devices that we have made? As I get the video. No questions. Okay. Okay. Only see burning. Okay. Okay. So let me share the video. Okay. So you can see the video, guys. Is it clear? Okay. I'll play. So as you can see the face of patient 1. He has already a smiling face compared before. So we want him to stand by himself. And the doctor said about his case during this time, he was improving fast. Even his physical therapist, when he was walking during the therapy, he was having he was bringing the belt, and now after how many times she told also okay, wait for a while, so let's watch the video first. She told us that she can already burning the patient 1 can already walk properly even in just few days from the So before, he cannot do that by himself last week. So he can come back. Just a 1 week recovery. Okay, so the pain was gone. His first report was his first report was that the back pain or the pain of surgery was not evident anymore. He doesn't feel the pain, but the night before he was laying down on the bed, there was a sudden electricity, a very fine electricity blasted towards the where the wound where was the wound is still fresh inside. He could feel the electricity just connected to his spinal, and he told his daughter to remove first the foam because he was shocked, and he was thinking that how could he be shocked, but there was no battery on it and there was not connected in the outlet. So he was just shocked. There was a sudden connection to that, and after a while he just put it on the side, as you can see in the video, and after a few minutes he put it back and rested. And so he had a good sleep. Yes, he has a good sleep, and we can already see his aura there. When we visited, he was already light and happy and full of hope. So we were sharing to him. He was sharing to him. He was sharing to us his experience and his hopes, because he was afraid that it was already the end of his life, that he could not work. For he has three daughter, and he's still not schooling because he has no work. So he was full of his will. We asked him that if he wants to survive and work again, he needs to have an intention to get healed fast. So before we give him the device, like the pen, we already give him good intentions that he will recover. So we ask him how long he wants to recover fast. So we asked the timeline from him. So we told him that the doctor said you need 6 months to recover, to walk properly and to go home. So what is your intention, or how long do you want? So he told us that he wants to be home before Christmas. So it's about from few weeks from now. So we told him, okay, your wish is your command. And after that, a week after, so we can see fast recovery of him, and eventually I believe he can go home before Christmas. And we will get official reports and documents from the doctor. I will be acquiring it once he will be going out to the hospital already, and to get the proper medical documentations, so we can share it, and we have really medical reports, because the nurses there are recording a daily journal. So we haven't have the access yet right now. They're still completing it. So once it's complete, we'll make a medical study paper for that. So we will include his surgery, from surgery and everything, the medical process until the recovery, and we will monitor him within the next 6 months when he will be in his house. So this is a very nice sign. In just 1 week, he has already been recovering. So Armen, when he visited here yesterday, just one day, he visited the patient as well. We went to the hospital. So he met Arman. So Arman met this guy. So it was great that we shared, and Arman was happy to see the guy also being already active. So with this with this case, we can just conclude for us right now, even at early stage, that the plasma devices and coils and patches, what we are making here and you're making out there, can really do great effects in repairing, especially repairing wounds or repairing pains. So for recovery. So hopefully we will have more of this, and we will have an incoming case, which is a case on schizo, what we call it, schizocephalus. So it's on the brain. There's a water on the brain. So not hydrocephalus, schizocephalus. So soon we will also do make devices for that little boy. He's 3 years old. So at least with this first step, because it's just 1 week time also, we met this guy and we were collaborating with the hospital just 3 weeks ago. So within 3 weeks, we have already good results, which is very exciting for us. Okay, so let me stop sharing.
So Renan, it seems like he found the pad a little too intense, perhaps, to after the initial electrical feeling. Did he ever use the pad again, or was it not necessary after
No,
that point?
after that electrical feeling, he just waited for about a few minutes, and he put the pad again. He put the bed foam again, so he didn't feel any electrocution anymore. Just that once. I think for me, it's just the first the first energy that was really required for his cells to repair. After that, only minor fields have been communicating. So that was the first, the one blast to complete the recovery of the cells. So from then on, yeah.
It's interesting in terms of, it's almost like the technique of aligning the nano layers when we do the various treatments by using a meter, or the voltmeter, or ohm meter type thing. It's like it started that electrical flow for him, or not electrical, I should say plasma flow, and he felt the electrical response in his body. So it was probably one of the best things that could happen to start that off, I would think.
Yes, that was I think that was how the plasma connected to his body in a way. After that, that's already the conditioning. So he was already receiving the fields according to what he needs, and the recovery was going smooth. So by Thursday, maybe we're gonna visit him again, and we will get more videos. So we will be doing more documentation on this case until we see the full recovery. And also, one thing that okay, so any questions on that case? I'll do other
Renan?
case. Yes, Sandy?
Hi, Renan. Question about the GANs you used. I'm really finding this interesting. Thank you so much. The GANs, you showed the eggs that you crushed up, which I really think is really interesting. And I'm sure you probably used it for the calcium in it and so forth. Was there anything else in the GANs, or do you know of what all the elements were that you get out of the eggshells? All I know about is the calcium.
Yeah, we use the eggshells is for calcium. So to help bone growth. So that the goal was to support the growing of bones, to recover the bones that were affected by the bacteria. So the eggshells was for the calcium. We were looking for, so we cannot find human bones, so we just use eggshells. So it still has calcium.
So all of the coils, the full length, were covered with the calcium, or were some covered with something else? And just All of them with calcium.
GANs and caustic mix.
Okay.
This was the mixture. So we put it in a spray bottle. Then after that, we spray the coils. Then we steam it. Usual steaming, just steam. So from after steaming, so we have already copper coils with calcium, energy of calcium.
Did you think about putting anything with it and decide not to?
No, we just decided for calcium, so we will see the recovery for the bone. So at least we can differentiate and other cases eventually. So for that, the very need was to recover the spinal bones, the spinal column. So we go on to the greatest need. So after, if you recover the bones can produce anything that it needs. So I think that was the main ingredient for the coils to interact with the connection with the bones, the energy of the bones or the plasma of the bone,
The
the
coils in the
nanomaterial.
belt,
The coils in
are they coated? Are they coated with calcium, the coils in the belt?
The coils in the belt are without calcium because the coils we used there were my old coils. They were made long before, so we just use it. Use it for that just to contain the fields because the coils is on his chest. So it was on his chest. Then there were no more coils at the back. It was just a rubber. So the coils was on his chest. So what we're doing is when the fields will push, will penetrate the bones, and there will be excess of fields coming out. We're just assuming there will be excess fields coming out here. There will be a barrier or a coil in front to push it back. So there will be no losses of plasma fields that is interacting to his body. So when it's pushed at the back and there's another nanomaterial here, so all the fields are contained.
Great.
So that's where our assumptions for that setup. So on the area of, let's put here only because it's the area of the pain or the bigger surgery was in this area, in this at the back.
And the belt's just a CO2 patch, water.
Yeah.
Yeah.
CO2 water, the same
CO2
source.
Yeah. Oh, great. Mm-hmm.
So
Renan, I have a question about the nanomaterials you use. You said he has titanium in his back, right?
yes, the bones were supported with titanium tubes and screws.
All right. I have a concern. I was wondering if you can clear it up. I'll talk to Keshe about it and see what he says. The nanomaterial inside, if the fields go inside the body, and that metal's inside the body in a GAN state, the nanomaterial might interact with the titanium and produce some GANs that may be helpful or maybe not be helpful or maybe harmful. You know anything about that?
Yes, that's one thing we were considering that if there's an interaction with the titanium. So what we consider to him, instead of using it 24/7, he will be just using it a lesser time after the first week of recovery. So I think the thing is after he has the first week of recovery, he will be using the bed instead of the whole night. We'll be using it the first hour, second hour. So we'll not make it longer. And so to avoid any complications with the titanium metal that was embedded. So we were also thinking that if he wish that the titanium metal will be removed, it will be another case because if it depends on that patient, if we are also teaching them the principles of plasma, not only with the devices, but we're also processing him emotionally. We're digging up all his emotions and everything. So we're doing holistic treatment, as Mr. Keshe said, is you really don't treat the physicality. We process first the emotions. So we also, before the device, when we were explaining the device how to use, we were also explaining, asking him about his emotions, asking him about that. So at least with that case, we know what is his intention. So it depends if the metal, he will decide, because the doctor told us that it will be a permanent surgery, so it cannot be removed or something like that. So if he has the intentions to remove it, then the plasma and the devices are still there. So there will be a possibility that the metal titanium will be rejected by the body if it has a capability to restore itself to its original structure. So it might remove the titanium in a certain way. So we don't know yet. So we will check it out if the titanium will be dissolved or it will be pushed out. So we asked him, he wants it to be removed. So his intentions was he wants to recover again without the metal at the back. So that's his intentions as well. So we're looking into that also. So that's why we will monitor it continually, even if he is already out in the hospital. Thank you, Brett.
Thank you.
Any more questions?
It's interesting that titanium dioxide is what's used on donuts to make them nice and white. So maybe you're creating donuts inside them in a way. It could be a good thing.
He's gonna color them all. Maybe he become Wolverine.
Titanium is generally non-reactive in the body. That's why they use it, of course, for surgery. But also titanium dioxide is used in everything from ointments through to healthcare products and all kinds of things, actually. We probably all have titanium dioxide inside of us right now.
Yeah. Okay, so any more questions? I will show another picture of this emergency case. So this is just an emergency case that we recover. I'll just show the picture. I already showed this in the class. I'll just show it to the public and explain what happened for a while. I'll share picture. Okay, for a while, give me patient. Okay, so this is an emergency case. So what happened to this is that the case was about a 4-year-old girl was rushed to the emergency room of the social service hospital because of severe pneumonia. So the case was severe pneumonia. So she was already unconscious and was given nebulizer with Ventolin and oxygen. So the doctor was already in emergency mode. They were monitoring. They put oximeter on his fingers to monitor the oxygen saturation. So what happened was I was putting my pen. This pen is the big one. This is the Vortex pen that I'm using. So it's a configuration of a coil that is in vortex shape with a ordinary single coil pointing downwards to direct the fields. And from there, I was doing it on the palm of the little girl. Here in the picture, there I was scanning it and just letting it float there for a while. Then what happened was it was on 3 minutes. The doctor said that what she was asking about the oxygen saturation level. So before I did it, it was 74%. So 74% of oxygen saturation. Normal is 100%, and recovery stage is 95%. So if you're in 95%, you can recover. You're in recovery already. So the little girl was in 74%, and the consciousness level, conscious is 15. The level of unconsciousness was already 10. So 10 is unconscious level. So with that situation, the doctor was gonna diagnose or gonna do intubation. You putting a tube inside the mouth of the girl just to pump air, oxygen inside the near the lungs. So that will be the next case if she won't recover in few minutes. They were calling for ambulance already, so we were waiting for the ambulance to arrive to bring her to the bigger hospital. So after that, within just 3 minutes, applying the fields on her palm and putting a water guns patch on her chest, the oxygen saturation jumped from 74% to 96%. And the doctor told us that she never seen any case of severe pneumonia to recover as fast as that in just 3 minutes. And the little girl also had consciousness. She woke up and looked for her mom. So she cried and looked for her mom because her mom was already crying outside and doesn't know what to do. So from there, I went out after 3 minutes and we sat down. Then the doctor told her mom that what happened, and the doctor told us also what was the case. So he shared that was a very quick recovery that happened. So the thing in plasma, I think in plasma, I understood why it recovers the oxygen so quickly on that stage. I was floating the pen on the area of an acupoint wherein treating the lungs. There was an area in the palm that you can see to treat the lungs. There's an acupoint there. There's a certain acupoint that you can apply to treat the lungs. So I was floating the pen there. So with that, I was energizing the lungs. So then with the patches on the chest, it helps contain the fields, and it also needs the fields coming out. So what happened with that, with being energized the lungs, so the lungs recovered quickly and provided proper oxygenation on her blood. So it was just a quick emergency case, but it was sad to know that after a week like that, the little girl was sent to our public hospital here in our place, and we have a very worst public hospital. So never mind. So what happened was the little girl died in the other hospital because she was not taken care of. She had another attack there, and the mom just told us that what happened to her daughter. So we were saddened. We haven't give her any devices to carry on that time. We should have did something. But we know that time when I did the processing, the doctor, our friend doctor, was convinced. She was so. I will stop share. So she was convinced on plasma technology. So that's why with that case, she told us that she will be going on board and become an official knowledge seeker and be part of the Keshe Foundation Philippines. So that was the transition stage for us to have access in the social service hospital. So maybe that was the plan. Okay, and also the severe pneumonia case. Right now, the doctor, we gave her a pen, the same as that, what I was using, and she's also using it with her patients. So she used it after diagnosing all the medical terms, medical medicines and everything. So she used it. She gives the patch to the mother to put it on the chest, and she does it on the pen, on the pump. So she has recovered more patients fast. That's why she's very excited. Even her, she has experienced it. So we will have a plasma doctor soon, a convert in here in the Philippines. So the one thing that I realized that using the technology here, especially on health, we can really present it to the world that the technology, plasma technology, is really working very well for many patients, especially in our third world countries where we have no access of proper therapies or alternative therapies to heal. We still use cancer the traditional way, chemotherapy, radiation. So right now we will be dealing with more critical illnesses. There will be available cases on cancer, so on different transplants. So we will do those things so we can test the technology into a more deeper level with just simple devices. So we'll not create those complicated designs. We'll just use our simple gas, the patches with water. We'll use the coils configuration, the same coils. So we'll not complicate everything. We'll just use simple things and do proper combinations. So okay. So hopefully we can share more and present to you, to all knowledge seekers, and be encouraged to communicate to your doctors in your localities. Share the technology to them because it can really help humanity. So go to them. They will, if they see the effect, they will help you how to go about it. You can see the real doctors by that time, because the real doctors are the ones who really wants, who really helps patients, doesn't need to gain profit on their patients. So they really need. So we tap a doctor right here with a great heart. That's why we can expand with this technology in health fast because of these testings. And we will eventually soon we will be presenting more cases on the brain, the heart, or the different parts of different cases of different parts of the body that we will be dealing. Okay, so any more questions? I have latest experience. Just want to share with you. I just went to a christening last Sunday. Yeah, last Sunday. I know a week ago, Sunday, that there was a stroke happened to an old lady, and it's so funny that we were just near the same table. So I got the pen again, the pen that I used. So just uh, hover on her arm for about 5 minutes, and she was already, her mouth was like grasping for oxygen, just doing bubble, and it's just full of food yet. I think she was already 81 years old. She was eating, then suddenly she was sitting down eating and put her head on the back of the chair, and suddenly close her eyes. Then we were shocked. So I came immediately, and there was a nurse who helped me. He hold the back and the head firmly straight. So I did the processing on the hands. So about 5 minutes, it took 5 or 7 minutes. She gained consciousness again. Then after that, they were already calling at the ambulance. So she recovered already. Then I gave her patches because I bring patches everywhere. I just put it in the car. We make about 100 or 200 patches, the plastic one. We put it in the car. So in any emergency, we can just get. And from there, I gave her the patches and maybe that was her niece, or no, maybe she was very young, but it was a relative. So she got it, and she was brought to the hospital. By evening, our friend who invited us the christening, she texted me. And told me that uh, she was asking, she was thanking us that we did and gave the patches to her grandma, to that grandma, because the grandma told her that without those patches or the processing on the hand, she would have not recovered. So right now the grandma is still alive. So she was recovered so quick, and there was already, when in the hospital, he was tested okay. So there was no more problem. So that was just a nice case, scenario for emergencies. So emergency tested pen, emergency tested pens configurations will soon eventually be in the line for production soon. Or because we will continue to test it in more emergency cases or certain recoveries, heart attacks, strokes, anything for that. So at least we have already our plasma emergency kit on testing. Soon will be out in the market. And also people will try to test with those small pens with you. In case of emergency, you can do a hand. Just believe. That's one thing. The greatest thing that is required for us knowledge seekers is to really trust in the technology, that it really works. So that's one thing that I put also in my mind every time I do it, because everything in your intentions really count when using plasma technology. So all the good intentions are amplified. All the healing intentions are amplified. So make use of it in a proper way. So it is for peace technology, healing technology, for treatment processing technology. So do those things, apply it in a way that you can help your neighbors, especially your neighbors that is just around you. Okay, so any more questions?
There's a question in the couple of questions in the live stream chat here. One from Gerb Peters, who asks, Renan, are you able to enforce the correct way of growing the bone structure, such as for brittle bones? How can this be influenced or corrected if needed? Thank you.
We will see that when we will have more information or more data on the recovery of patient one. So I cannot answer it right now because it's still just too early. We've been just 1 week and a half in the process. I just show you the recovery on pain and his motor skills. So we will see into it when there will be X-rays that will made or MRI scannings. I will be getting in touch with the doctor to see the difference in the appearance of the growth of the bones. So we will look into that soon. So this will take a process to know the effect on the bones inside.
Okay, that sounds good. JJ asks, this is kind of a tricky question maybe, because the person says, I have a patient with a blood clot inside the brain. I'm using the health pad and the health pen and wondering what else would Renan recommend. I don't know if you should be recommending for brain clots for someone else, but
I cannot recommend anything. I'm not a professional doctor, so you need to get in touch with your professional doctor. So for us here, I am sharing things that in my experience, and also with documentations with a professional doctor. So I can explain it by the way the doctor already shared to me. So, but doing experiments on your patients, so you need to do it at your own risk, at your risk of your patients. So I cannot recommend anything. So you need to understand first the technology in totality, which is, we know plasma is the totality. It's not only removing pain. It's not only healing the physicality. So you need to do the healing of the emotions first, or the processing of the emotions. From then you can process the physicality. So two ways. So you need in today's term, you need a psychologist and a doctor to do it in a way. But if you are well equipped, some maybe a counselor can help in the process of the emotions, and in the physicality, a doctor can help you interpret it. And with that information, you can create the devices that Mr. Kesh told us, like linking the nanomaterials, what gases can be used physically for the body, how much salt required. So we can use the information on the workshops, previous health workshops shared by Mr. Kesh, how to treat or process different ailments. So any questions? Any more questions on that case?
Yeah, well, there's the age-old question that comes up. Are the coils, from Mary, are the coils made clockwise or counterclockwise? It's a trick question that'll involve at least an hour of discussion.
Okay, the coils are turned in a counterclockwise way. So it's a right threading clockwise, counterclockwise rotation. So right thread, counterclockwise rotation. So we always use the counterclockwise for help for a specific reason, because counterclockwise fields are the positron fields. So it needs positive fields for human body to work positively, instead of having the electron fields or the negative fields. So we use counterclockwise. We also have this information with the monks here, who had informed us that they do things in their process counterclockwise. So they sweep the floor counterclockwise, like that. Those things. So we also inquired. Some of our group here inquired the monks about this, how counterclockwise works for health and totality. So it's just the proper energy field that requires the body. So we don't need the opposite. We use the opposite, the clockwise turning for other devices, not for health, not for human and animals. Maybe for plants on energy or car or anything. So that's what we're using.
Okay, there is a question from Scientia Intuitiva. What about recovery from cognitive defects after ischemic strokes? Any experiences with that? Could you ask Renan? So he's wondering about recovery from cognitive defects after strokes.
We will have a case on that next month. Next month. So we will test it. So our from strokes, maybe because he cannot already move left part of his body, or he cannot move the hands. It depends in which part. So we will be trying the helmet. So we'll be asking the patient or the information of the patient, which part of the brain has been damaged. So if the helmet, we will design the helmet to direct the fields on that area. And maybe for brain, CO2 guns will do, and zinc oxide and CO2 guns will help recover the brain. So we will see to it. We will check it yet. So we have not implemented it yet, but we have already a patient waiting for that. So maybe soon we'll have a case for strokes that we can share information legally. For now, no comment for that yet. So But if you have supervision with your doctor, you can you can ask her or him the status of the brain, which one is affected, and everything. So you can create the devices and concentrate the fields there in that area. And also more patches on the different motor areas of the body to help it a continual flow. It's like having a power system. You need to have a connection, cascading connection. So you put the load in the middle and you have a cascading unit there. So connect it. So it's the same. So you have a coil somewhere on the physicality on the head, and eventually it flows down. So you need some other coils to contain it or to have balance on those different organs that were affected because of the nerves or the nervous system has been disconnected due to the stroke or the veins have been cut. Don't know. So you can ask your doctor for information in that case. An update for my father, and he is still doing great. Thanks to Mr. Keshe and the plasma devices that have been used for a long time right now. So he's recovering well, and we just use supplements. Just supplements for no more. We are not using any more drugs, medical drugs at home for our family for almost 5 years now. For my father, we just cut off everything on the medical already. So we're using plasma devices, and we believe on the technology and also the intentions to use it and help others as well. We had just a presentation with senior citizens last Sunday. So it was quite exciting. I met a 105-year-old woman she can still stand, can still listen, everything. So she can still function well. Very old, and we just showed them the pens, the patches to heal, and we got so many testimonies afterwards. After doing an orientation, we shared the technology, give them the pens and the patches. Instant effects. People there were mostly old people, have many rheumatisms, pain at the back. So after applying in just few minutes, they were already giving us testimonies. It's gone, the pain was gone, and that. So it was exciting. So sharing this way, if you have a group doing this outreach, you can really see how the technology is so important. And with it, instead of making so many devices for now, if you can make the simple ones, share it more, you can have more ideas along the way. But if you have already your pens, your belts, you can create that, and you can create time for sharing the technology. I encourage you to share the technology and let them see the immediate effects, especially for the elderly, which have been already most of the elderly have been neglected already. So you can reach out to that sector of your society.
Renan, Renan, there's not much time left, but we have someone that's interested in your drawing abilities and would like you to draw the health pen, please.
Okay. So the health pens which are on the market right now are just so simple. I just throw the coils. I don't know if it's counter, but it's all counterclockwise. And this one. Yeah. So then I put the pen. This is the pen's ink, and this is the ballpoint. Okay, so sorry for my phone. So it's like that. So this is the ink. It goes through there, the ink and the ballpoint, and you just insert the spring pointing downwards, both of them. So this has no end here. It's a closed loop like that. Points. So this is for the common pains. This is in the it's those who were testing our pens here in the Philippines. So many are already ordering for it, just testing it. This is the one coming out. This is a simple one, but the one in Italy is the bigger one. So it has bigger fields. I think it's double coil or triple coil. So this is the basic one of the first original designs that I keep on using every day wherever I go. And also the other devices. The other device, we use this oil like this. Just
Is that the is that what people call the vortex pen?
Yeah, this is the vortex pen with a directional coil inside pointing down. Or this kind of coil, the same here. This one is to just put there. So this is I use for emergency cases. This is a quicker one. So this is for common, and this is for usually emergency cases. Fast effect. So you can make this. You can build this at your houses and share the technology.
May I ask a question about the first drawing, please?
Okay.
This one here. When you make that pen, what do you simply take a long piece of wire, fold it in half, and then wind the coil out of it, or is it two separate pieces of wire?
Yes, that's the one.
With
folded the wire and coil.
Thank you.
Counterclockwise. So you don't have a loss, and you are putting a direction downwards. So the fields here coming in. So when you hold the pen here, you're the nearest plasma. So you probably the source for the energy, or you ask another source of energy to provide the pen, to provide your patient.
Do you polarize the coil of the pen with a voltmeter? Is a question.
During the nano coating, I just do random, because there are so many pieces, which I just do random discharging for during the so I don't have polarization, which is the positive or negative. I just do the voltmeter on the what we call the tray, the metal screen tray, and to the coils. I just run it through. Like that. So plenty of it. So I didn't do any proper, which is positive or negative. So usually I think the negative will be the nanocoated. I'm not so keen on that polarization thing. I think maybe that's for the energy system, but we use fire here, so we polarize it using the fire. So for the pen, in my nano coating, there's no actual polar, where's the exit or entrance. So it's dictated here by the points of the field. And always remember that the pens are just tools. I can share to you the experience where most of us here are already using our hands. So you can also use your hands and fingers like the pen. You can process pain fast. So you need to learn more on the plasma. So practice how to understand how it works, and eventually you can understand this one. It's nanomaterial. To understand the body as well, we are made up of ganses. The bones are nanomaterials, and the ganses are our skin, our tissues. So we're still made of this. So what this can do, we can also do as a entity, as a plasma entity. So that's thing. I think that's the our presentation for today. Rick, is it already 12? It's already.
Yeah, it's just about that time. There was one more question, but it's one of those trick questions again that might get involved, which is what GANs for chronic lymphocytic leukemia? And that's just the question. What GANs to use? Well, I mean, you would have to spend another hour just to talk about which technique, which GANs, and all of that, and it would have to probably be in a private session.
Ask first the doctor about the condition of that sickness and what are the minerals that are being dilapidated or what is less in that body with that certain condition. So with the doctor's diagnosis and everything, you can see what are the minerals that lacks or in excess in the body. So you can look into that aspect.
Can I ask a administrative question?
Yes.
Quickly.
Okay, Sandy.
You say you're handing out all these pads, which is just great. I'm wondering, how are you labeling them? Do you have some kind of sticker in them, or you hand them out with a leaflet, or?
With the sticker. We put sticker on it, and before we hand it out, there are instructions. We share it with the instructions, and we put small stickers on it on how to use. So at least they know that it's for personal use, and after a while, if it will dry out, they can throw it away as garbage. If they want to still reuse it, they just wet it again and put it inside other plastic. But we stated there mostly is how to use it, how to apply it. There's about 5 steps, and also the caution not to share it. That's the patches we were giving away.
And how do you actually identify it? When it says ingredients, what do you put down?
We say water, energized water.
Okay.
Yeah, that's the only ingredient. You see tissue paper inside, and it's wet, so it's energized water.
That's wonderful. Wonderful. Thank you.
Hard to argue with energized water. You know, what do you mean energized water?
We're drinking energized drinks, energized water. So that one is a very generic name for it, energized water.
Good.
Patches.
Okay, Renan. Good job. Thank you very much for the presentation today. Excellent. And
Thank you so much.
I think that'll wrap it up for today's health teaching workshop for Tuesday, December 1st, 2015. And thank you everybody for attending once more. Okay, I'll end the live stream and we'll stop the recording.
So it's the pulmonary, the lungs or the pulmonary part of the body has been affected by the bacteria or the virus. So what happens is it eats up the different areas of the lungs, then causing the lungs to fail. So just the simple, definition of it, not medical. So I'm not medical, so I'll tell you that the simple definition. So next is what happens to this patient. He had the tuberculosis bacteria went to his spine. So he had a worse case than the normal staying in the lungs. So his lungs has TB, but it went through his spine. So his backbone. So there are 4 parts of his backbone have been infected with the virus, with the bacteria. So what happened with this is the bones was eaten up. So the condition was supposedly he was not able. The doctor said that he cannot survive. If there will be an operation, it will have 50-50 chance to recover. So what he did, the hospital did. So they did proper diagnosis on it and did surgery. So they removed the infection and arrange the bones again at the back. Arrange the broken bones or the crushed bones or the infected bones. This one here, they arrange it again, and this one, another one, another one. They arrange it and they put a metal case, a metal tube here. It's a titanium just to support it because it cannot handle anymore this weight. So it's the good bone spine here and this spine here cannot handle this one. So it will collapse. So they put a connection just to connect again the spine. So basically the surgery was a success for the patient, but he was told that he cannot do his natural work anymore and will need to recover for 6 months or 1 year before he could walk without assistance. So he's also undergoing a therapy right now that physical therapy to help him walk. So I will show you pictures and before and after we applied plasma gadgets in his recovery. So this case we didn't do any.
Okay, welcome everyone to the 48th Health Teaching Workshop of the Keshe Foundation Spaceship Institute. It's Tuesday, December 1st, 2015, and we're here with Renan today to give us a teaching, and I believe he's ready to go there. Hi, Renan.
Hello, good morning, good evening, and good afternoon, everyone. So I'll be giving a case, or we'll be discussing to you a health case and using of our devices in our social service hospital. So just to give you a background, we're dealing with, let me see, for a while with a Facebook. No. Okay, so we're dealing with tuberculosis. So a different way of tuberculosis, I'll check the Wikipedia. Let's read it. Can you help me, Rick, just for tuberculosis? For Wikipedia, yeah, just read on the tuberculosis. I got my window shut down. Yes. Okay. Okay. So that's okay. Okay. So just the background. So the TB virus or the bacteria, TB bacteria is common in the tropical countries like Philippines. So we have conditions here. That's why there is TB vaccines have been spread around the country. But this case about tuberculosis is we're seeing a more severe case on tuberculosis. So, okay, can I share my video? Okay, so the TB, usually it's on the lungs. Interview for him before giving him the device provided. Oh, sorry. I forgot. Okay, I did screen share it for a while. I thought I was screen sharing. Share screen video. Okay. Okay, so you can see the video. So play the video. Okay, so this is the patient one. So in this condition, he's still lying down, resting, and we're giving him instructions on what we will give him. So the device that we will give him. So I'll move it forward. So we're explaining, this is the finished product or finished device, the foam and a belt. So I will show you how we made it later. So how to use it, and I'll move forward. So our knowledge seeker Danny is explaining how it works. To belt it around his chest so that to have a close field. And let me go forward. I'll show the motor skills. So we're just putting how to put that there. Okay. We're explaining to him how the fields will interact when it's wrapped around his body. And this one is another one is the cup that we are using for him. So it's with the one I discussed a few months ago, last August, the health cup. So with the coils and patches together. So we use this both for water, drinking water, energized water to energize the water, and also we use it for breathing or a breather to energize the lungs, the brain, and the heart. So instead of putting water in it, we just put a straw to breathe on. So if he wants to empower the lower part of his body, the physicality, he use it in his daily drinking of water. Okay, so let me go on. So we're testing here. Okay, I'll go back. We're testing here his leg skills, motor skills. If he can raise it long enough. Okay. Okay, so he's doing great now. He's gonna raise it. But one thing, there's still vibrations or jolting of the foot. It's like it vibrates, see? So you can see that it vibrates or it pairs or processing on the illness, but we are doing repairs or processing on the recovery. So I'll share my pictures on how, what are the gadgets or what are the devices that we use for him to recover. So with the doctor's advice, she told us that with normal medication and rest and proper therapy, physical therapy, he will walk without any assistance within after 6 months of therapy. So that's their diagnosis, and that's their hope that he can still recover. But he can have difficulty in moving because of the pain and the uncomfortable feeling of the metals on his back. So that will be the case. So I will show you first the device before we put on what happened afterwards. Okay, so I'll share my picture for a while. Okay. So now you can see this is patient 1. So I'll not just use his name. Patient 1, that was his case. So I'll show you the pictures of his surgery. It was a good surgery. So the surgeon was good. So this was the already healed, already closed. So this was 1 month after surgery. You can see his back. So it has a long cut. So in this is the middle part. They put the spine, the metal, the titanium in that area. So he's just wearing one of the devices. But before that, I'll show you a video that is testing the motor skills of the patient. I will share the video for a while. Ang imong gusto dapat makabarog na ka. Just for a while. Okay. Ikaw ra usad ay maka-normal na. Can you, is there audio? Una yung kontrata sa Ginoo. Okay, I'll just mute the audio because it's in our dialect. Okay. So this is Bernie, patient 1 that we are doing. It has still a involuntary muscle action. Yeah, it's like a twitch, when you, because it's there's it's not complete yet, so the recovery is not complete yet. So there's a reaction in his motor skills that it twitches. So okay, so that's Dr. Solosha who is administering the patient. Okay, here you can see still it's hard for him to sit down. Okay, and we need to let him stand, so he needs assistance to just support his back before he could stand. This was last November 19. Okay, so we let him walk, try to walk. So okay, few steps. The pain is still there at the at the back part. Okay, let me see. So now you see the patient who's already in recovery mode, but needs to recover for 6 months. So right now we provided him the plasma bed, or which called the nano health wire and patches bed, for him to help him process the recuperating or the healing of the wound, and also the pain, and also hopefully we recover the motor skills fast so he can walk and everything. So we're just preparing those things, and okay, we teach him how to wear the belt just there, just to complete the fields interaction, because the bed or the foam has already all the fields coming out. So just to have a complete loop, we use the belt in the area of the wound around his body. Okay, so yes.
I'm reminded that it might be a good idea just to let people know that we don't encourage anyone to do these experiments without complete supervision with medical doctors involved, which is the case the way you're working with it now. This is an actual